There are over 100,000 people in Long Beach who don't have access to basic health insurance, either because they can't afford private insurance or because they make too much to qualify for Medi-Cal. But this will all change at the beginning of next year when the Medi-Cal expansion is expected to take effect all across California. When this happens, at least 95% of Long Beach residents who don't have health insurance can finally have access to affordable health care. The Medi-Cal expansion in Long Beach will not be easy, and it will not take place overnight. People who qualify for the expansion will not be automatically enrolled. Rather, they will have to come and bring in documents showing proof of citizenship and proof of income eligibility. One of the places in Long Beach where people can bring in their documents is the Children's Health Clinic, where VoiceWaves got a chance to speak to CEO Dr. Elisa Nicholas about the Medi-Cal expansion and how the Affordable Care Act will impact Long Beach.
I think the biggest health issues are obesity, heart disease, asthma, and mental health issues. One of the big populations that's going to be affected by the ACA are the childless adults that are low income. They will now be eligible for Medi-Cal. In the past, they were not. Or if you had a child that aged out, so let's say you had children under 18, the whole family was eligible for Medi-Cal. But when the child turned 19, everybody was uninsured. Now, all of those that are low income, no matter what your age is, will be eligible for Medi-Cal. The outreach and education that needs to be done, I think, needs to be targeted to specific ethnic groups, but also to specific age groups. So the 18 to 35 group is one of the largest groups. About 31% of that age group is uninsured. So, and most of them, almost all of them will be eligible either for Medi-Cal or for the California benefits, Covered California insurance if they don't get their insurance through their workplace. So you need to target that young adult age through social media and different kinds of outreach. Then the other is the ethnic populations through the ethnic media and outreach through different groups that are working with ethnic groups in town. I think the barriers in implementing ACA, the language barriers, I would say they're language and literacy barriers. We still have a significant population that have low literacy levels and are monolingual in a language other than English. So I think that's one of the challenges, and the way we would approach it is to make sure that the outreach is in the appropriate language and the materials are at a level that people can understand. And that is very difficult to do sometimes with complex enrollment programs. I think it's just really the understanding of what we're doing. I think for some people, taking the amount out of their monthly pay to pay for insurance, so if they're above a certain income level, they'll get no subsidization, and it could be a significant amount in their monthly premiums they have to pay. Whereas if they don't get any insurance, then there will be a penalty at the end, but that penalty may be significantly less than what they would have to pay on a monthly basis. So I think there will be some probably cost for those that are not the Medi-Cal level of poverty, the more of the working poor or the middle class that are going to be maybe harder for them to give up that disposable income every month to pay for the insurance. I think personally it's worth it, because if you have a catastrophic illness, or if you can do prevention, you're going to be healthier if you have health insurance and really have access to preventive care and early health care rather than waiting. But sometimes when people are having to make decisions, it's hard to make that decision.